Welcome to Let's Talk Mental Health, where we bring awareness to the causes and solutions of mental health conditions. I'm your host, Nathan Nedley, and we are talking about severe depression. 6.9% of Americans had at least one episode of major depressive disorder at one point during the past year. I've got Dr. Neil Nedley with me. What are the symptoms of not only depression, but specifically severe depression?
Severe depression has several diagnostic hallmark symptoms that are associated with it. One of them that tends to be very clear in most individuals with severe depression is apathy. Another is lack of focus and concentration and difficulty in making good decisions. A third is morbid thoughts, where they're actually thinking that they might be better off dead or having other morbid thoughts. And then feelings of worthlessness are also very much connected with severe depression. So we tend to see those four symptoms prevalent in most people that come to our program with severe depression.
So let's start with apathy. How can I recognize this symptom?
Well, you first recognize it because you wake up in the morning and you're not excited about the day. And that can happen to everyone once in a great while, but when it happens consistently or the majority of the time, that is distinctly abnormal. We should wake up with an interest in the day and an enthusiasm of carrying out our activities that day. But then it can progress to the point where the things that used to be pleasurable are no longer pleasurable for you. And it can even progress beyond that, where now it starts affecting motivation. This apathy now, the things that used to be motivated to do or achieve worthy goals, you no longer maybe even have goals. And that's a sign of severe apathy. And then it can get to the point where you don't even really want to leave your house. Your relatives are saying, get out, come to this restaurant, and I think you'll like it. And if you do go, you're thinking, I just want out of here and I want back home. And that is classic severe apathy. And there's many that come to our program with that symptom.
What about the problems focusing or concentration? I mean, I guess it seems a bit more easy to diagnose or recognize in oneself, but is there particular things that maybe people don't recognize that they have these issues?
Yeah, often they think it's kind of normal, but it starts out by you reading something that's interesting to you. You get to the bottom of the page and you realize you forgot what was at the top of the page. And you're having to go back and read it again. And maybe even the second time through, you realize, you know what, I missed it again. And that is lack of focus and concentration. And it can get to the point where now you're not even able to make good decisions. You realize that the fog that you're in with this brain and lack of focus is threatening your ability to be able to make good decisions. So you tend to put those off. And it, of course, can affect your academic performance, your work performance, and that's when people start seeking our help.
The third one you mentioned is morbid thoughts. This one seems very significant. How can someone recognize that?
Well, often they just feel that we'd be better off dead, or they would wish that they don't wake up in the morning. And that's a clear sign that morbid thoughts are there. But actually, the definition of morbid thoughts is being preoccupied with death or symbols of death. And so people that resonate with symbols of death, who are wanting to wear clothes or tattoos that have symbols of death. You can go into any tattoo parlor today and tattoo symbols of death on yourself, crossbones, skeletons, these type of things. My wife showed me the other day of a bathing suit line that's all crossbones and skeletons now. And so people who resonate with these symbols of death, it's a clear sign of morbid thoughts. Or they might be actually into self-mutilating. That can be a sign of morbid thoughts. And self-mutilation is also at an all-time high. And then, of course, it gets very severe when you're actually thinking that you would like to end your life, and then even thinking of ways of doing that. And of course, that's when we're very much at the danger zone, and that's when intervention needs to occur.
The last symptom you mentioned, which I'm sure ties into the morbid thoughts, is feelings of worthlessness. What's the key recognitions behind this symptom?
Well, this also underscores that many people with depression have distortions in their thoughts. The thoughts on the surface appear valid, but they'll learn that they're irrational or just plain wrong, and that twisted thinking is a major cause of the suffering. It turns out that if we have any ability to be useful to ourselves or others, we're not worthless. But a person with severe depression thinks they are worthless. And they actually firmly believe that, that whatever they are, that they're trash, that their body image is terrible, or, all of these things that they put on themselves. They think they'll never amount to anything, that, life just should be over for whatever reason. These feelings of worthlessness are actually irrational. And part of the solution is not only improving their brain chemistry, but actually helping them to reframe their thoughts into what is accurate. Accurate thoughts turns out to actually help our feelings in major ways. And so this is why it also requires a comprehensive approach. We not only have to deal with the chemistry issues, we have to deal with the thought issues behind it.
Our final question for you today is, from your perspective as a physician, what are you seeing the key components behind these 4 symptoms?
Well, as a physician and dealing with the medical side of things, it's my job to look at the brain chemistry. And so I'll tell you that dopamine is a problem behind the apathy. Norepinephrine is a problem behind the focus and concentration. And then there's serotonin involved in regards to these feelings of worthlessness and morbid thoughts, plus dopamine and a little bit of norepinephrine. So we have a combination producing those 2 types of symptoms. And so where I'm going to be looking at is not only those symptoms, but I'll document the brain chemistry behind it. And that's why we can get to having some great solutions in fixing that brain chemistry aspect of things. And then our counselors will help with the thought part of things. And that's how we're able to take someone with these severe symptoms, and in 10 days, they just won't be there.
Well, thank you for your time, Dr. Nedley. Be sure to subscribe to stay updated on our latest uploads. This is Let's Talk Mental Health. I'm your host, Nathan Nedley, and as always, stay healthy, live happy.